Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about elevation and its role in controlling swelling after knee replacement surgery. Hey everyone, how's it going? We're talking today about elevation after knee replacement surgery. So we talked about icing, of course, very popular, very important, very helpful. We've talked about the use of compression to help with swelling and inflammation and edema after surgery. And today we're going to do just a short talk about elevation. So elevating the leg to help with managing swelling, managing edema after surgery. So a couple of things to think about. So with elevation, how does it work? Relatively simple. So you raise the body part up, in this case the leg, and raising it up is going to take advantage of the force of gravity, and all the fluid and the blood flow is going to come down towards where gravity is taking it, and you're going to have less blood flow, less fluid in the knee and in that area. You're going to have improved return to the heart and return through the body's system, and ideally a limitation and reducing of the swelling. So a couple things to keep in mind is when you are elevating the leg, you want to have it above the level of your heart. So if you're sitting up tall and then you raise the leg up on a recliner, you may not have that leg above your chest and above your heart, and you're not really getting the benefits of the elevation. So typically what you want to do is lay down on a surface, lay it out on your bed, on your couch, whatever it may be, and then you're going to have some way to elevate the leg. Very common, very easy way is stacking up some pillows. You can also purchase a wedge or something of that nature to elevate the leg onto. And of course, there's other ways to be creative to get that leg up and in the air. Now, something to keep in mind, especially in the first few weeks after surgery, you don't want to have the knee significantly bent. So you shouldn't have the pillows or whatever it is right under your knees so your knee and your leg is bent. The reason for this is after surgery, we want to restore knee extension. Knee straightening is very important to try to get that back quickly after surgery because it's very important for your function, for your outcome, for just the overall recovery after surgery. So having the knee in that bent position for prolonged periods of time can lead to developing that scar tissue and reducing your ability to straighten the knee fully. So the way to do it is to have the pillows in this longitudinal lengthwise along your leg so that it's under both your lower leg, your calf, your knee, and then a little bit of your thigh as well. So that way the knee is relatively straight. A little bit of bend is okay to be expected, but relatively straight overall. Again, you want to have that leg and knee above the level of the heart. So one common thing that you see is people will actually sleep with the legs elevated, and this can help be a little bit more comfortable for some people and actually help them get a little bit more sleep after knee replacement surgery. And it's really perfectly okay to have the legs elevated for extended periods of time, but you want to at least try to get 15 to 20 minutes a couple of times each day. And again, this is especially important and especially helpful in those first week to 3 weeks maybe after having your surgery, just because that's the time where you're really going to have that increased level of swelling, pain, fluid buildup. And of course, it's perfectly all right, and it can be very beneficial to use elevation at other times throughout your journey after surgery. Maybe you have a really tough physical therapy session, really tough exercise, and you just feel like the leg feels full, feel like there's a lot of fluid, feel like it's heavy, swollen, perfectly all right and perfectly useful to try some elevation in that case as well. There are some additional benefits too that you can get with the use of elevation. A lot of people find that it provides some relief, takes some tension and pressure off the low back, which is a common complaint for people in general, but also after surgery. So that can provide a little bit of relief and comfort in that way. And it's just good for general swelling and general fluid buildup in your lower legs, in your feet. If you have a job where you're on your feet all day, elevate those legs and help reduce some swelling and discomfort. It's also good for the veins and the venous return of blood back through the heart and back through your circulatory, back through your vascular system. So a couple of additional benefits as well. Some things to be aware of if you are someone with any type of cardiovascular, any type of heart condition, such as congestive heart failure, if you're someone who has peripheral artery disease, atherosclerosis, high blood pressure, if you're someone who just has anything that's related to the heart, the cardiovascular system, I would very strongly recommend before you try elevation, before you utilize elevation, to get the blessing and get the advice from your surgeon, from your doctor, whoever it may be, so that it is or is not all right to do that. The one concern is if you're increasing this blood flow, this return to the heart, we don't want to overwhelm the heart. If you especially have like a weak heart or congestive heart failure or something like that, we don't really want to overwhelm that by elevating the legs up and having all this increased blood flow and return. And that kind of holds true for things like compression as well, I would say. Just make sure that you talk to your doctor, talk to your surgeon about that, and make sure that it's all right to do. All right. So thank you very much for watching, everyone. Hope you got some useful information. Let me know in the comments any questions, any thoughts. What have you been using to manage your swelling? Have you found these techniques beneficial and useful? Do you have any other secret technique or really great technique that you want to use and want to share with all of us? Let me know. So thank you very much for watching, everyone, and take care.